Lifting.
It's moving.
When you hear a scream like that and then silence, things have either gone really, really well or really, really badly. Very excited to be reacting to House MD Season 6 Episode 22, requested by Mr. Poe, our second ever Omega channel member. On this channel we are reacting to all 177 House videos. This will be episode 47. Let's see if I can get a diagnosis before House does as a doctor working in London.
A crane collapsed in downtown Trenton.
Oh, an unconventional episode where House is on the scene of a disaster. This one should be a good one. Situation like this may seem unrealistic, but just yesterday a crane collapsed in Atlanta, injuring 4 workers and displacing thousands of people. There was a major disaster in Mecca in 2015 as well, where 100 people were killed. And in 2022 in Edmonton, there was a crane collapse caught on camera. So as a doctor, we would likely call this a mass casualty trauma situation. And so the conventional rulebook becomes only useful as firewood. That's because we don't treat people based on their presenting complaint or the possibility of having a severe injury or illness. We use something called the START triage method, which means simple triage and rapid treatment. Can they walk? Are they breathing? Is that breathing normal? What is their mental status? Then we assign patients to one of 4 categories. Injuries incompatible with life, like decapitation. Needs immediate life-saving interventions like a severed artery or punctured lung. Injuries that are not immediately life-threatening, like a head trauma with normal mental status, no red flags like vomiting or blackouts. Or the last category is minor injuries like skin cuts that haven't affected arteries. Treatments are then given quickly so we can move on to the next most urgent savable patient.
I only nodded off for a second. I lost control of the load.
Caffeine pills. You fell asleep taking these?
I drank 2 cups of coffee too.
You passed out.
Oh, this is getting very spicy. House thinks that this patient didn't fall asleep, but the patient thinks he did, and since he's been so tired, loss of consciousness generally is caused by 2 things: syncope or seizure. Now, a patient may not remember a seizure, and it can make them feel tired and disoriented afterward, without necessarily causing a dramatic classic limb jerking that we usually see. You can also have absent seizures where you black out, or very interesting partial seizures when people experience deja vu because the brain is making you re-experience a memory. Some people have reported out-of-body experiences with partial seizures, like visualizing or experiencing seeing yourself as a double. The exact spot that causes this phenomenon is the temporoparietal junction. That was discovered in a pretty interesting way. It was reported in 2002 when a Swiss neurosurgeon named Blank, who was anything but, had to treat a 43-year-old woman who had epileptic seizures for the last 11 years. The condition wouldn't respond to drugs, and so the epileptic focus had to be found for targeted therapy. They had difficulty finding it, so they had to use a technique that let them stimulate multiple areas in the brain at once. Small electrical signals were used in those different areas. Some made expected results like muscle movements or strange sensations. When they found the seizure focus and stimulated that, they knew where this spot was and removed it. What they didn't realize is when they stimulated this temporoparietal junction that she described that she could see herself from above. That's how it was discovered. Thankfully, no cats were harmed in the making of this discovery. So what could have caused these seizures? Let's get more clues.
Somebody down here!
Anybody hear me?
Oh, being stuck under rubble looks about as comfortable as food poisoning on a bus. The longest survivor under rubble was in Turkey when a 29-year-old mother of 2 was found alive 258 hours after an earthquake. that killed 43,000 people. She survived on trickles of rainwater from a nearby opening and blankets tugged from the walls to prevent hypothermia. Even after making it out though, survivors needed to overcome crush syndrome, which is when a slurry of toxins are released from a pinned or mashed limb that is deprived of blood flow, causing massive systemic changes in electrolyte balance and inflammatory responses. That's why before lifting out a weight off of someone, rescuers usually apply a tourniquet to stop the poisoned blood from flowing into the rest of the body. They then put a line directly into the bone and rehydrate the person to dilute the toxins until they can get the person on dialysis to help filter those toxins from the crush syndrome area. Crazy stuff.
What's your name?
Hannah.
What day of the week is it?
Tuesday.
I'm gonna try to pull you out.
Oh, my leg! Oh!
House. Just when I said we shouldn't pull out crushed limbs without a tourniquet. As an infectious diseases consultant, House could definitely use some support here. The first thing I'd want to check in this situation before doing anything with this patient is it safe? Because the last thing they need is two people stuck under the rubble. Then before mental status, I would want to check the breathing. She was talking freely, so that would show you that at least there's no upper airway obstruction. So I'd want to look at the chest. Is it rising symmetrically? Then, you know how some people love tapping on a watermelon to see how ripe it is? Doctors love tapping on the chest to see how healthy it is. I tap both sides to see if one side is hyperresonant or dull. Hyperresonant, like tapping on a balloon, could mean that there's a punctured lung and the chest is filling with air that is slowly pushing the thoracic organs away and about to cause total circulatory collapse. Stony dull, like tapping on a rock, could mean that blood is filling in the chest that needs to be drained. Now, since she's his only possible patient right now, he can check circulation and only then does he go onto mental status. He could use an abbreviated scoring system like AVPU for a quick assessment. People with A category are alert. V means they're responsive to voice but not spontaneously alert. P means not responsive to voice but are to pain. And U means totally unresponsive. Kind of like your ex after a booty call. Now House knows she isn't critically unwell. The smart move would be to get back out while he can and get some backup, or he could channel something called hysterical strength, where people gain seemingly superhuman powers of strength in life or death situations. Just like in 2012 when a father was working underneath a BMW and the jack propping it up slipped, dropping the car on top of him. His 22-year-old daughter named Lauren Kornacki saw this, lifted the car off him and performed CPR on him to save his life, as she claimed it happened. Maybe House has some Lauren Kornacki in him? Let's find out.
I need to get help.
He's still in the ER, House. We haven't had time to start a differential.
Perfect! Let's start right now. What causes syncope?
Your guy's stable. The 24 other patients.
Need to be diagnosed. They just need to be bandaged.
I love how House's Rubble patient, Hannah, is only interesting before he knows who's under there. After getting out, he's like, nah, this puzzle isn't hard enough. Pass me the next one, please.
Come on, man! That's too easy!
So the bus driver who lost consciousness and was feeling tired will need some basic assessment like listening to his heart, doing a lying and standing blood pressure, blood tests including sugar levels, ECG, and likely 24-hour tape. If that's normal, EEG to check for seizure activity, then take it from there. Now, a question for you smart people. What percentage of people have had a faint? Answers down below.
Space-occupying lesion in his brain is most likely. MRI will prove I'm right.
Everything checks out okay.
My nose is bleeding.
Oh, we've got a new symptom. Bleeding from the eye. Whenever anyone says bleeding from the eyes, the first thing everyone thinks of is Ebola, but the rest of his eye looks alright, and the last time I checked, House isn't working in Sierra Leone. So what else could this be? Trauma could cause it, but that would be a bit too easy. The nosebleed could cause it if it flows at fast. You can, in theory, get backward flow up through the nasolacrimal duct that goes from the medial part of the eye down to the nose. Another spicy House-esque cause could be a clotting dysfunction, but how would that link to loss of consciousness? It would make sense if you had an intracranial hemorrhage that caused it, but the MRI was normal. One very interesting case report that was published back in the early 2000s was of a patient with lower back mass called a meningocele that caused loss of consciousness and retinal hemorrhage because of displaced CSF from the meningocele into his head. That's quite an idea. If you did an opening pressure with an LP, that could pick it up. Definitely want other investigations like I mentioned above around about now as well. Meanwhile, Cuddy has gotten engaged and moving in with her new partner. House feels she's being shady about it, but Mr. Baby Blues seems to be going green with envy.
We can't lift it without jeopardizing everyone down here. So it's time to discuss amputation.
Rubble.
We're not cutting off her leg.
Get an X-ray venogram. Also look for venous sinus thrombosis.
I'm apparently the only one who can see this other guy.
Oh, this is getting very interesting. House is supporting this patient because he can see parallels in his case and hers. The crush injury risk versus the risk of reperfusion syndrome when he had the clot in his leg. Them amputating his leg versus doing a procedure to revascularize the leg to try and save it. He was doing so well defending her for a while and then promised that he won't let them cut off the leg. Although I'm not sure how he's going to deliver on that promise from the hospital. Venous sinus thrombosis that House wants to test the crane operator for is a very interesting condition. The brain has oxygenated blood going up and supplying it through the circle of Willis, and that blood needs to get back to the heart somehow, and that trip back is through the countryside highway of the venous sinuses. When you get a clot in the arteries, you get a stroke as oxygenated blood can't get into a portion of the brain. But get a clot in the sinuses and your symptoms aren't quite as obvious. Pressure builds up, causing headaches, blurred vision, fainting, swelling around the eyes, and occasionally the feeling of pressure in the ear. It mainly affects females between age 35 to 50, and treatment is with blood thinning medication and stopping any offending medicine like combined hormonal contraceptives. So our crane operator isn't in the right gender, but he's definitely the right age. So such an interesting case. I love this episode with two patients in it at the same time. They're always the best.
Hannah's freaking out. You have to go back.
Can I ask what's wrong with your leg?
Grain fell on it.
Would you pray with me?
I don't believe in God.
I don't either.
House is obviously a very intelligent guy and he's an atheist. There are plenty of other examples from the modern day like Stephen Hawking or Elon Musk, although Musk does think we are living in a simulation. So can you be a person of science and still be religious? Let's take a look at history. So Albert Einstein, for example, believed that God existed but not in a personal way. He was nebulous, universal and incomprehensible to the human mind. Contrary to popular belief, Charles Darwin in 1879 said, "I've never actually been an atheist in the sense of denying the existence of God," and was thought to be religious. On the other hand, we've got Galileo, who said, "I do not feel obliged to believe that the same God who has endowed us with senses, reason and intellect has intended us to forego their use." So it seems like there were varied opinions and that the number of atheists amongst famous scientists could be disproportionately higher than in the general population, especially adjusting for the number of people who are religious at a certain point in time. But what about the modern day? Are atheists smarter than theists? There is over a century of data investigating this exact topic, and a guy named Derlinger in 2022 performed a meta-analysis of it to try and answer that very question. It seems religiousness has a negative correlation with intelligence as evidenced by psychometric testing like IQ, with religious people generally scoring 6 points lower than their atheist counterparts. But that association disappears when looking at academic achievement, like SAT scores, for example. The authors explain this as things like education level and goal setting or discipline correlated more with those scores rather than innate intelligence, like the psychometric tests indicate. So it seems there is a correlation, albeit a small one. But how are trends changing with time? Well, that depends on where you live. Generally, the number of atheists worldwide is slowly growing, unless you're in Russia or the Middle East. So, quite interesting.
No feeling defects. You think we could be friends?
Yeah. We'll catch a ball game or a group sex show or something.
I've seen House do all kinds of things. Kidnap a veteran to fix his phantom limb, take a bribe from the mafia, roast Vogler in front of millions of viewers. I thought nothing he said or did could surprise me, but here I am, as surprised as a skydiver with no parachute. Now it seems like they're going to try and release her from the rubble, as they've been unloading some of the weight that the metal beam had on top of it. Back in the hospital, our crane operator had a negative venogram. I still fancy our meningocele theory with raised intracranial pressure. Hopefully they lumbar puncture him soon to find out.
Put the crewman in there.
Okay, when the beam starts lifting, you're gonna feel pain. It's gonna be like your foot's gone to sleep times a billion.
You must have felt this sensation when your dream self decides to try and rid you of one of your arms, rolling onto one. You only discover that when you wake up and it's totally numb, you can't move it and it's floppy. As soon as you release the pressure, you feel pins and needles, the medical term of which is paresthesia, and that's the blood flowing back into the arm to the muscles and sensory nerves. Those nerves then overfire, sending signals to the brain that there's a problem there and they've been irritated. A similar thing is happening in this situation, except instead of your body, she has 10 tons of steel on her leg. That means that there isn't just a lack of blood supply to the area, but also crush injuries that her nerves aren't able to feel right now, that they will be feeling while overstimulated very shortly. If this is a simulation, something tells me it isn't coded by Paddington Bear.
Lifting.
When you hear a scream like that and then silence, things have either gone really, really well or really, really badly. I suspect this might be the latter. Now you may notice neither House or the rescuer were wearing a mask while down there, which is not the greatest idea. That's because those small particles of dust, when inhaled, can stay in the lungs for years, like unwelcomed in-laws. No matter how much hoovering you do, they still stick around. The body then mounts an inflammatory response against them locally. Over time, that can cause scarring on the lung and a condition called idiopathic pulmonary fibrosis. It has a 5-year survival rate after diagnosis of just 62%. So the lesson here is that protection is not just for late nights and janitor's closets. Now, if you want some protected perks, then check out the channel membership, priority reply to comments, early access to new videos, and being able to suggest a series and episode for me to react to are just some of the benefits. For a limited time only, the first 30 members have a chance to win a 1-hour, one-on-one medical tutor session with me on a topic of your choice. We currently have 19 members with only 11 spots left, so make sure to join now to secure your spot. Also, the earlier you join, the earlier I can react to your suggestions, so press join now.
I think the adjacent beam stepped during the lift. Mayday, mayday, mayday!
No breath sounds on the left side. Tension in the thorax.
Damn. Hannah is not having a good day. She said earlier that she thought if she does good things, then good things will happen to her, but now she's under a pile of rubble with one functioning lung, covered with dust, and a leg that she needs to risk her life to save. Thank you, Karma. One thing I was very impressed with in this scene was the accuracy of House's needle in the chest, which is called a needle thoracocentesis. We do this in a very specific way. Second rib space and draw a line down from the center of the collarbone. The location of the needle within this space is important too, because underneath each rib is a neurovascular bundle with intercostal arteries, veins, and nerves, which are not ideal to hit. So you have to go on the superior aspect of the inferior rib and press down until you hear that hissing sound with the needle, as we just heard. That is just pressure inside the chest from the air buildup being released and allowing the lung to reinflate. Something that wasn't quite accurate though is that House said she had no breath sounds on the right side, but with no stethoscope. He must have ultrasonic ears. Otherwise, you could find it from tapping on the chest and finding that hyperresonance I mentioned earlier.
Now the guy's starting to spike a fever.
Meningitis?
Do an LP.
Because of the collapse, you can't try the airbag again until we get everything off the tap. Be 5 or 6 hours at least.
Then we have to amputate.
No.
Oh, tough decisions to make, since after 6 to 8 hours of lack of blood supply, a limb tends to no longer be viable, so the body can deliver small amounts of oxygenated blood through an accessory pathway. This episode reminds me of the story of Aron Ralston, an American mountaineer who in April 2003 was descending a canyon and dislodged a boulder which pinned his wrist to the canyon wall. He was there for 5 days as he had a water supply, otherwise dehydration would have taken him out after just 3 days. Then when he knew nobody was coming for him, he tried to cut off his arm with a dull pocket knife, but couldn't get through the bone, so had to break it using the boulder as a fulcrum. Not only that, after amputating his limb, he then needed to descend down a 20-meter drop and hike 5 miles to a safe space. Absolute madness, and you can see it all in the film called 127 Hours that is based on his story.
I'm the only one here who knows what a leg is worth.
Please don't put her life at risk just to get back at me.
So this is all about you now.
Oh, there are so many layers to this. It's like TV lasagna. Firstly, there's the whole thing that House is projecting his views onto the patient based on what happened in his situation. Hannah trusts him and is listening to his opinion, which is why she's refusing the amputation. The thing is, when he's making those decisions for himself, that's absolutely fine, as if he wants to go red or black with his own life, then that's his call. As soon as you start doing that with patients, you're treading on piranha-infested thin ice while wearing underwear fashioned from fish food. Then there's this whole Cuddy situation. She clearly wants to believe this is about her, and a small proportion of it will be, but that isn't the main driver for his actions. The annoying thing about the human brain is that it quite frequently tries to locate connections when there are none. I ate strawberries yesterday, now I have acne. It's not such a stretch to say strawberries give you acne. At the extreme, we call this apophenia when people see meaningful connections between unrelated things. It's what gives rise to many conspiracy theories and can lead people to very peculiar states of mind. Either that, or I'm crazy and they're the smart ones solving Elon Musk's simulation puzzle.
What are you clinging to, House? You're gonna risk her life just to save her leg? Really worked out well for you, didn't it? What do you have in your life? Honestly, tell me.
Hannah, we have to amputate your leg.
Oh, what? Cuddy just unleashed a firing squad of truth bullets directly at House. Now, in England growing up, there was this saying, if you don't have anything nice to say, then don't say anything at all. I guess Cuddy's American. Now, what does that saying even mean, though? We should be polite, we should be friendly, we should be positive. But here's the thing. Is it nice to let someone carry on making bad decisions? Should I not tell my alcoholic patients they're doing something wrong when they're drinking 1 liter of vodka a day because it'll make them feel bad? Is our true opinion something we should keep to ourselves and put on a brave face while keeping calm and carrying on? Truth has value. People dislike social media because people say things that they wouldn't say in real life. The truth is that when people aren't faced with the possible recourse of physical violence, then they say what they really think. Why did Musk pay $44 billion for Twitter? Those real conversations are constructive and help to shape the future of humanity. It may be painful to hear some of those opinions sometimes, but we have to be able to, if we're going to have a real conversation where we can tease these things out. This is a great example. Cuddy may have been harsh, but she likely helped House to convince the patient to do the right thing in this situation. You'd rather be outwardly unpleasant for the right reasons than nice for unpleasant reasons.
You asked me how I'd hurt my leg. I had a blood clot, and the muscle was dying. I had all these doctors telling me I should amputate, and I said no. I'm in pain every day. It changed me.
Wow, it's crazy hearing this story described from House after seeing it happen in 3 stories. It seems like the first time House is finally admitting that the decision he made, being so stubborn and wanting to try and keep his leg, was probably the wrong decision in the end. That even though it saved his leg, he traded his well-being for it to a point where it wasn't worth it anymore. An observation though, is that really the case? And if he truly believes what he's saying here, then why keep the leg? The option for amputation is always open. Cutting bits off is easy. It's keeping them on in situations like this that can be the hard part.
Now I'm alone. You have a life. And this is just a leg.
Okay.
I can't put you out. Depress your respiration too much. It should take away some of the pain.
He convinced her! But of all the procedures that House has done, lumbar puncture on a plane, intubating a patient with a DNIR, and pulling a 25-foot tapeworm out from a girl's bowel while she's awake, this has to be the craziest. So why is that? Underground, surrounded by rubble, isn't exactly a sterile field. After House manages to take the leg off, he will have a small window of around 30 minutes to make sure that the arteries are ligated off and the wound is closed. Any longer than that, the patient will likely bleed to death. Thirdly, there is also an incredibly small area to get out of here once the surgery is done, and doing that while keeping the wound clean and without blood going everywhere will be very challenging. Now, the drug he gave was likely morphine, and that would take the edge off, but you could easily sedate the patient enough to do this procedure with some midazolam without risking respiratory depression. House may not have that on hand though, and this sure does make for good television.
How bad will it hurt?
Like nothing you've ever felt before.
I'm so sorry.
Shut up.
You always love my legs.
I don't care about your legs.
Watching this just makes that Aron Ralston story even crazier. The fact that he did what House just did, but to himself, and with no sedation or bone saw, the lengths that humans can go to when backed against the wall are crazy. What's even crazier is House seeing this and imagining what his relationship with his then wife, now ex-wife, could have been like if he accepted what was happening to him, if he didn't go aggressive and go crazy about keeping the leg. It is understandable though that it's difficult facing reality when you've defeated it so many times. I need to give credit where it's due, and Universal have done incredibly well with the writing on this one. So a question for you smart people. What would you do if you were in Aron Ralston's scenario? Would you be able to cut off your own limb? Answers down below.
Fallen into a coma. LP was clean, but...
What are his vitals?
Excuse me, officer.
You mean officer? How long has there been a cop there?
It's a bit curious that he's gone into a coma just when a cop turned up. Presumably it's a real coma and he's not just playing sleeping logs. If so, then why would he go unconscious in response to stress though? You could say that it is vasovagal syncope, but that doesn't explain why he had the nose and eye bleed. So it all could be explained by massive fluctuations in his blood pressure, to be fair, high blood pressure causing the bleed and low blood pressure causing the loss of consciousness or coma. Autonomic dysreflexia could cause that. It's where the body's autonomic nervous system that controls the fight or flight and rest or digest systems become overactive. In his case, it could be either due to an upper spinal cord injury or recreational drug use. Maybe when coffee wasn't cutting it, he went for something a little stronger, but it doesn't quite fit, as I'm sure the team would have done a tox screen and figured that one out. And his BP on the monitor was 155/90, which is high, not low. That could be an old reading though, if someone hasn't pressed the repeat blood pressure button. Let's find out more. I'm not convinced by this theory.
He was being questioned when he fell into the coma.
He was claustrophobic right before the bleed and before the fever. We told him that he probably did fall asleep.
This is BP spiking.
Oh, okay, so maybe I wasn't far off with my theory as I may have thought. Something still doesn't quite fit though. as 85% of autonomic dysreflexia cases are initiated by a problem in the bladder. It could be because of a catheter, urinary tract infection, or a full distended bladder. If not a problem with the bladder though, then usually the bowel itself is the trigger, and this patient doesn't have either. So what other autonomic problems would this be? Could still be vasovagal syncope, but that is a bit too simple for House. Could be postural orthostatic tachycardia syndrome, where your heart beats too quickly when you're standing. Could be multiple systems atrophy, which is a type of Parkinson's disease that particularly targets the autonomic nervous system. You could diagnose that using a tilt table test where it changes your body's position and assesses how you cope with those changes. The other thing though is that these causes I mentioned are very difficult to treat. So again, something doesn't quite add up. I think House may have got me on this one, to be honest.
I thought the problem was at his toilet, and by that, of course, I mean his head, which distracted us from the fact that it could have been just a clog in his sewer pipe, and by that, of course, I mean his spinal cord.
No way. So that case report about the meningocele, is that what he has? If so, that would be insane. It seems like House is saying that caused the spike in BPs though, and that caused his symptoms rather than the intracranial pressure, and the patient's LP was normal. I'm not sure exactly how he's justifying that because of the cyst with normal intracranial pressure. Maybe they just didn't do the opening pressure on the LP because they didn't suspect it could be high. That is possible, as you do have to apply a manometer to test that pressure, so maybe the team didn't. Very exciting.
A recognized cyst on his lower spine, that's why we missed it. He's been sitting 10 hours a day, spiked his spinal fluid pressure.
Run a CT.
Oh, it was because of the spinal cord cyst. Oh, said that so early, but I didn't quite stick to my theory. Does that count? Let me know down below. Maybe I should also start keeping score, although I think House is thrashing me at the moment. Seems like Hannah has taken a turn for the worse as well from her breathing. It could be a fat embolism after major trauma like she's had, or we know she did have a tension pneumothorax earlier, and when that happens, it's because of a defect in the lining of the lung, which means the air in the lung can get sucked back directly into the chest after it's aspirated. So after that needle decompression, House would have needed to insert a chest drain tube with a one-way valve so air can only move out rather than in. Usually that valve consists of a tube being stuck underwater so bubbles flow out and a small amount of water is drawn just into the tube. You always make sure that seal is below the patient though, as you don't want that water to get into the chest wall. Doing a chest drain procedure, you need to be very careful. I used to do these a lot in cardiothoracic. Once you make the incision, 5th intercostal space, mid-axillary line, you dissect down to the chest wall and then puncture the lining of the chest wall called the pleura with a blunt object to make sure you don't damage any structures underneath. Sometimes that needs a bit of force, and when you get the give from the pleura, you can jerk forward. So someone in my center once pushed so hard that he ended up putting the tube inside the patient's heart. Why drain the patient's pneumothorax when you can drain the patient's entire circulating volume? Luckily, they operated immediately and saved the patient, closing the intraventricular rupture. Pretty crazy.
It's not another pneumothorax. Neck vein's flat. There's no tamponade. Damn it, I waited too long. Hannah, you've got a clot in your lungs. I'm gonna fix this.
How does House know he can fix it? Yes, it could be a pulmonary embolism due to a clot, and if it is a fat embolism though, then that is much more difficult. After trauma, the fat from the bone marrow can get dislodged and travel up into the lungs. That stops the usual oxygen transfer in the lungs to the blood. We can help support the patient by giving high flow oxygen or even taking over the job of their hearts and lungs using an ECMO machine. That just buys us time though, and unless the underlying cause can be removed, then the patient won't make it through. I've got a bad feeling about this one.
IV streptokinase.
It's not busting the clot. It's not a clot. It's a fat embolism. And the amputation.
Come on. Do something. Please, please, do something.
The amputation killed her, so was it the wrong decision? You can argue that even if he did it earlier, it would have had the same outcome, since he would have had to go through the same bone, displacing the marrow in the same way. The increased pressure in the center of the bone pushes debris into the venous system. It's to the point where if you stick an echo on the right heart, you can actually see the bone debris floating in the blood while the operation is ongoing. If someone has good respiratory function, that may not cause them a problem, but it does depend on how much embolism there is. So what could House have done? If he didn't amputate, then he'd be dealing with crush syndrome, which also can be fatal, and the risk of fat embolism in a situation like this is still less than 2%. Oh, forget crush syndrome, House will be crushed by this.
This wasn't your fault. That's the point! I did everything right. She died anyway. I shouldn't be alone right now. Get out of my way.
What's that?
I'm asking for some time off.
Oh, it's all falling apart. 13 has been struggling with her Huntington's disease, and House seems like he's about to go start a fight with Tyson Fury. Losing a patient like this can really knock you back. I had a scenario when I was on palliative care, and a 5-year-old girl came into us in the hospice for symptom control. She had a rare syndrome and was having uncontrollable seizures. We tried first-line medication, second-line medication, third-line medication. We had the neurologist involved. We gave her IV medication directly. Got to the point where her epilepsy was so bad that she needed a constant infusion of midazolam, and even that didn't control her seizures. Eventually, we had to put her on phenobarbital, which is an extremely potent drug, and that sedated her completely. The thing is, you can only be under sedation like that for so long until you develop pneumonia or go into respiratory depression. But every time we tried to down titrate the dose, she would start seizing again. Eventually, we had to keep the infusion going, and I still remember the day she died at just 5 years old. And I'll never forget that patient. We really are mortal. Oh, seems like House has been doing so well off his medication, and this traumatic event is what caused him to relapse. He isn't alone. Addiction is powerful, and part of the reason why we get addicted to a certain thing, like alcohol, drugs, gambling, or sex, can be as a coping mechanism. To try and overcome that, services try to give new coping strategies, like with Alcoholics Anonymous. They have the 10 steps, using God to help people cope, or smokers can use patches to reduce craving, or a vape so they have something to suck on instead. But what happens when those new coping mechanisms get overloaded? What can you do? For many people, it's straight back to old habits, and that's why it takes an average of 7 attempts at quitting a particular addiction to actually stomp it out. House is on the cusp right now. Let's hope he makes the right decision.
You gonna leap across the room and grab them out of my hand?
No. It's your choice if you want to go back on drugs.
Okay, here to yell at me again?
No, all I can think about is you.
What? This episode has more twists and turns than an octopus on a funfair ride. After roasting him out in the field and telling him to move on, now she's dumped her fiancé and wants to get back with House. It's like the total reverse of Joy in season 5 episode 6, when House was telling her that she wasn't ready for motherhood for the whole episode, and right at the end decided to tell her that she'd be a great mom and kiss her. Talk about mixed signals. Does make for incredible TV though. This episode gets an 8 out of 10 for entertainment, 7 out of 10 accuracy, 7 out of 10 for diagnosis. Very enjoyable.
I just need to know if you and I can work.
You think I can fix myself?
I don't know.
'Cause I'm the most screwed up person in the world.
I love you.
What on earth is going on? Wow, talk about a tumble dryer of feelings. I hope they work it out. House needs to get something to keep him going after all of what he's been through. The life of a genius is a solitary one, as evidenced by history, but maybe he can be the exception. This episode was very good, but if you want to see a totally insane one, then watch my reaction to House pulling out a 25-foot tapeworm from his patient right here. I'm Sermed, stay curious.